Recording in progress.
This webinar. My name is Donna Chow, and I'm your host and moderator for today's class with eLotus, your leading provider of TCM contained education. Today's webinar is from Theory to Clinic Patient Analysis 3, presented by Dr. Hsin Lin. So the goal of this class is to make it feel like you are shadowing a teacher right next to them in the clinic, watching how they see patients and asking questions. We do this by using a telemedicine model that lets us see each other from a distance. You will have the opportunity to see how Dr. Lin thinks strategically as he gives a diagnosis and treatment plan remotely. So you can do the same thing in your practice. Before he analyzes the case, we will provide the main complaint, a brief case history, and some background information about the patient. Then he's going to ask the patient some questions to help him understand the patient's symptoms better. Following the case analysis and prescribed treatment plan of herbs and acupuncture points, you, as the participant, may ask questions about the diagnosis, etiology, and rationale for herb and acupuncture selection. This is a golden opportunity to learn why certain herbs were rolled out for treatment and why certain prescriptions were made. Before I begin, I'd like to go over a few items to familiarize yourself with our webinars and how they work. Today's webinar is going to be from 9 to 11 a.m. Pacific time, and we will have one break. So the first half will be patient examination and questions. The second half will be formula and point discussion. So this is very important for you guys. If you want to be part of the chat, please set your chat preference to everyone so that everyone can see what you're typing and be part of the conversation. So this is very important because it's a very interactive webinar and we want everyone to participate. If you guys want to ask Dr. Lin specifically a question, enter your question into the Q&A box. That way he can see the questions clearly and it doesn't get lost in the chat. And finally, the quiz and video replay. So to get credit for today's class or to watch it again, you will be notified by email tomorrow once they are available. All right, guys, let's get started. And let me introduce to you Dr. Hsin Lin, who earned a Doctor of Medicine from China Medical University in Taiwan and worked as an associate professor in the Department of Traditional Chinese Medicine after completing a bachelor's degree at the same institution. He's taught for 12 years at the university and has been in private practice for over 20 years, and he specializes in difficult to treat conditions. He is one of the most knowledgeable and most patient speakers that we have with us here at eLotus, and we are so honored to have him. So let's go ahead and begin today's class and welcome Dr.
Lin.
Hi, Dr. Lin. Can you hear me?
Yes. So can you hear me?
Okay. Can everybody type in yes into the chat room if you can hear Dr. Lin and also can hear me?
Okay, good.
Wonderful. Thank you for coming, Dr. Lin. Today we have Erica, and her chief complaint is endometriosis along with long COVID. Donna's gonna help us type into the chat room. Oh, okay. Yes. Can you guys see it in the chat room? The list of all the symptoms she has and the meds? Yes, correct? Okay, so you guys can review that. So, and then we'll get started right now. So Dr. Lin, please go ahead. So he will ask you questions and then just go ahead and if you can, look into the camera and answer him. Thank you.
Okay. Okay. Hi, everybody. Hi, Erica. How are you? Oh, okay. Now I cannot hear your voice. So
1 second.
yeah, now I can get it. I can get it.
Okay,
Okay, good.
fantastic.
Thank you. Okay, now I'm very happy to hear again. So today we will discuss about your health condition and try to find a way to help you. So yeah, I have your simple information from website. You talk about your chief complaint is endometriosis and the long COVID syndrome, right?
Correct.
Okay, I think let's start from your long COVID system, okay?
Okay.
So when did you got the COVID infection?
March of 2020.
Okay. This year?
I'm sorry?
This year, March 2020? March 2020,
Hold on.
okay, got it.
Hold on 1 second. It's too loud, and so it's like blowing out. Okay. Much better.
Okay.
Thank you. Sorry about that, doctor.
Okay, good. So let me make sure again, you got the COVID infected on March 2020, right?
Correct.
Okay, so it's about 2 years ago, 2020, right? Okay, so from the beginning, I mean, after the COVID, you start have the symptom about the long COVID system, long COVID symptoms, just like you say, crushing fatigue and the long hours of sleep.
Yes.
Okay, so do you also feel physical energy very, very low?
Yes. I often describe it as my body doesn't have any energy stores left. When I get hit by the symptoms, the worst is when I'm, doing an activity as simple as like washing my dishes, and all of a sudden I feel like I'm full of lead, and I immediately have to lie down and rest. Oh, thank you. I have tiny. Oh, no. Hold on 1 second.
Yeah,
I
it's
have
okay.
tiny, tiny ears.
It's okay.
Yeah. Cool. So yeah, I feel like my limbs are just full of like concrete, and I get short of breath. Occasionally my lips turn purple. I have an oximeter at home and I measure my oxygen. It says it's fine, but it does not feel fine.
Okay, so the blood oxygen level is good, it's normal, but you're feeling, you just feel your physical energy low, right?
Correct.
Okay, so I was wondering, before you get the COVID, I mean, before the March 2020, do you also easy to feel tired?
Yes.
Okay, so it's not a new problem after COVID infection. Before that, you got the, kind of the symptom like this, but after the infection, it's worse, right?
Absolutely. Yeah,
Okay,
I've
good.
always had fatigue issues, but this was, just like the life had been sucked out of me.
Yeah. So the COVID infection issue just like a trigger make the former condition become worse, right?
Yep.
Okay,
Yeah,
good.
it amplified all
yes.
of the chronic issues that I've had for the majority of my life. It was like gas on a fire.
Okay. So about the long hours of sleep, before the COVID infection, you also have this symptom, right?
Yes.
Okay. So it sounds like every symptom about the long COVID symptom after the COVID infection, just like you say, amplified the symptom,
Mhm.
right? Actually, before that, you have all the symptoms.
Yes, but just nowhere even close to the degree that it is now.
Okay, so I think there's another information from the website. You also have the myalgic encephalomyelitis. So this diagnosis happened before the infection or after?
Before.
Okay. So I think that makes sense. The COVID just like a trigger, make those things before become worse. Okay, so is there any symptom you consider is connected to the fatigue, not only physical fatigue, physical weakness? Is there any other symptom you think is just connected with that?
I get what I call air hungry. So I'll be sitting, reading a book, or lately I've been coloring in coloring books, and I will unconsciously be just gasp. And so I'll be sitting there doing my thing, and all of a sudden, and everyone in the room hears it, and it's not even under my control.
Okay. So that's why you say it's air hungry. You always feel short of breath. You need more air, right?
Yes, I also find myself usually at night where I need to breathe either through my mouth, like these big, giant gulps of air, or I even feel myself like flaring my nostrils and using my accessory muscles to like really get that air in there. That even with a history of asthma, that is nothing I've ever experienced until now.
Okay. So don't you like talk to other people for a long time? I mean, speak for a long time?
I mean, not really. I mean, I used to teach EMT courses.
Oh, okay.
Because
That's
I
great.
used to be an EMT, but I don't really have the opportunity to do that much anymore. And if I am having a long conversation with someone, I need to sit down during it, and then I need to rest afterwards. So everything I do, taking a shower, washing the dishes, cooking a meal, everything I do, I have to rest before and after.
Okay. Even the conversation is not long. Maybe just a period of time of the conversation, you need to take a rest, right?
Correct.
Okay, good. So I think it's more difficult for you to, I mean, for your EMT course, you need to teach, you need a conversation, you need to speak to many people for a long time. I mean, a course maybe takes you 40 to 50 minutes. So do you feel I mean, severe exhausted after the classes?
Yes.
Okay, good. Okay, one more quick question. Did you take exercise regularly?
Do you exercise regularly?
I used to, but I can't anymore.
So what kind of exercise did you, did you do the exercise?
I love yoga and stretching. I used to take really intense dance classes. They're like 90 minutes, 5 to 6 days a week. And I could do that no problem. And now, you know, I take a shower and I'm done for at least 3-4 hours.
Oh my God, okay.
So giant change there.
Yeah, but all of the exercise you say seems not so powerful, right? I mean, yoga, stretch, or dance is not really powerful, very strong exercise, right?
Right.
Okay. So actually you did exercise before, but the exercise is not so strong.
Yeah, I mean, it's pretty much impossible.
Mm-mm.
I've tried and I've ended up in bed for
Mhm.
weeks.
Yeah. Okay, good. So did you also have a low back pain issue?
Hold on 1 second. Sorry.
Okay.
It's just my tiny ears being a pain in the
Okay.
butt.
Yeah.
Sorry about that. Can you repeat the
Okay.
question?
Yeah, sure. I asked hold on, I forget what I asked. Hold on.
Yeah. Thank you. That makes me feel a lot better.
Yeah, I really forget it. Okay, I think
Low back pain.
oh yeah.
Ah,
Did you I'm
thanks,
so sorry.
Donna.
Yeah, low back pain. Yes. Did you also have a
Yeah,
low back pain issue?
I've had low back pain my entire life. I have very dysfunctional SI joints. So
Mm,
they are constantly in and out of, they subluxate
mhm.
basically.
Okay. So did you have any sports injury or any fall down experience?
Oh, yeah. Anytime I tried to play any kind of sport, I get injured like weekly.
Mm-mm.
Especially my ankles, my right ankle. I've sprained my right ankle hundreds of times.
Oh, that's too bad. Yeah, you talk about this. I remember I got your simple information from website. You also be diagnosed with the hypermobile Ehlers-Danlos syndrome, right?
Yes, I do
Okay.
have a confirmed collagen
Mm-mm.
disorder.
Yeah, that's a disease because of some kind of the collagen leak. So makes your body over flexible joint, stretching skins,
Yes,
and
exactly.
abnormal scar formation. So I think that makes you feel, I mean, just like you say, when you do exercise, it's more easy be hurt because all the muscle group attach on bone and joint, right? So if your range of motion is too much, it's very easy to pull your structure, misalignment. So you can feel hurt.
Yeah, it's always been, in some of my joints, I don't really have a stopping point. So where a normal person's joint would stop, mine just keeps going.
Yeah.
And I'm 40 now, and so 40 years of my knees bending almost backwards. It's hard to relearn
Mm-mm.
proper joint
Yeah.
position.
Yes. Did you ask for help chiropractic or like physical therapy?
Yes. I'm
Yeah,
sorry, I don't
believe.
mean to laugh, but being a woman who has battled obesity her entire life, I have gone to hundreds of doctors from as early on as 10, 12, and just begging, like, my joints hurt all the time. My muscles are always stiff.
Mm-hmm.
What is wrong with me? And I was told, oh, you're just anxious. You're just fat. You are just depressed.
Mm-hmm.
And my personal favorite is you're crazy.
Mm-hmm.
There's nothing wrong with you.
Mm-hmm.
Because your labs and your x-rays are always normal.
Mm-hmm.
So yeah, I started PT, physical therapy, excuse me,
Mm-hmm. Yeah.
when I was 12,
Mm-hmm.
and I've been in and out of PT
Mm-hmm.
ever since.
Okay. Yeah, actually, I believe if you have the just like I said, the ED syndrome, like you, the range of motion is abnormal, so that also affect your muscle strength. So
Yes.
yeah, so I believe you really feel hurt when you do. I mean, if you do exercise too much. So it's really, I mean, there's really a problem we need to deal with. Yeah, it's not only just mental issue because it comes from physical. So also the mental unwell comes from together, combine with you together.
Absolutely. Yes.
Yeah.
Like, and thank you for believing me. I appreciate that.
I believe you. I believe you. Yeah, because of the ED syndrome, just like this. Yeah. Okay. So and one more thing, X-ray, maybe X-ray cannot find the problem about the ED syndrome because the collagen issue and the muscle condition, you cannot identify it from X-ray. So
correct. Yeah, I've always had normal X-rays. Minus, I've had a few fractures, so of course those are going to be abnormal. But no, it's all muscle and connective tissue. So yeah, so X-rays have been perfect.
So I think that also can explain why you are also diagnosed with the POTS. I mean the postural also static tachycardia syndrome, because people be diagnosed with this term most of the time, just like the definition, people easily feel heartbeat fast and short of breathe. And if you lie on the bed or on the sofa, you can feel better.
Yes, but exactly.
But when you erect your body again, it happens again easily. So many people got this diagnosis name because mental stress. But you should know the mental, why these people have the mental stress. Where is the mental stress comes from? So I think you'll be diagnosed. You are diagnosed not with this term. Not only because of you got some cardiopulmonary function problem, but also you have some stress. And the stress maybe, again, comes from your physical condition.
Yeah, it's a vicious cycle.
Yeah, absolutely. So now I think the strategy, we need to break this cycle from any possibility. I mean, you can pick any point, any point to break out. So that's why I ask you your long COVID symptom first, because the COVID just like a trigger. I said that again. It's just like a trigger. Can make all the things before you have become worse. So actually, we can forget the COVID. We can just focus on your former former problem and deal with that. So first one, I think you need to increase your cardiopulmonary function, because if in the TCM theory, if people got the heart and the kidney function lower, people always feel tired, no matter mental or physical. And people always feel, I like to fall asleep. I don't like to move. And I have no motivation, just like this. Okay, so I think the ED syndrome and the POTS, we can combine with your tired and deal with them together. Especially the ED syndrome is a congenital connective issue, connective tissue problem. I'm not sure if you use the herbal medicine can make it better easily or not, because it comes from congenital.
Right. I've tried all the supplements, and the problem isn't I don't have enough amino acids to build the collagen. It's my body, no matter what I give it, will always produce faulty collagen that doesn't do me a whole lot of good.
Wow, it's a lot of collagen you take.
Yeah.
Yeah. Okay. But about the POTS and about the fatigue, I think we can combine them and treat them together. It's a group. It's a group. It's a problem group. I mean, your fatigue and the POTS. They comes from the same reason, I think, in my experience. Okay. Okay. So let's talk about your endometriosis. Okay.
Okay.
So can you describe this?
Sure. So I started my period when I was 13 years old. And since that very first period, I have had just excruciating cramps. The pain gets so bad that I vomit. Sometimes I have passed out in the bathroom.
Okay.
I have had many, many trips to the emergency room for pain control. At one point, it was so bad that I had a standing order for IV morphine. And I had my first endometriosis surgery at 19 years old. They found horrific endometriosis. They removed it. I was fine until I got COVID. So I had next to zero pelvic pain. And then when I got COVID, one of the worst parts of it was, being stuck in bed, unable to really move. But my pelvic pain was just unreal. It was like I could feel the endometriosis growing. It was unlike anything I've ever experienced. And now I'm waiting to get in to see a famous surgeon here in the LA area to go in there and scrape it all out and get it out of me. I have daily pelvic pain. Periods are hell. Just the cramps and the nausea and pain radiating down my legs. They think I have endometriosis up in my diaphragm, possibly in my lungs, because of the abdominal and chest pain I get during my cycle.
Okay. So I know you do the surgery for the endometriosis about when you were 19 years old, right?
Yes.
Okay. And after that, everything is good until 2020, right?
Pretty much. I mean, so I'm on an oral birth control pill,
Yeah.
and I take it continuously. So I only have 3 to 5 periods a year. Just because it's excruciating. I can't function. I'm basically in bed with a heating pad. And just, I can't do anything. I am done for minimum 5 days.
So just like you say, after 2020, sorry, can you hear me?
No, I stopped hearing myself and you in the earpiece, but you're back. Sorry about that.
Okay, good. Okay, so from the 2020, you got the COVID, the menstruation pain come back and more severe than before.
Yes.
Okay, so now you still keep taking the pill. I mean, the medicine, just like mimic the pregnancy period to avoid the pain, right?
Yes.
Okay, but the pain still severe.
I'm sorry?
But the pain still severe when the menstruation period.
Yes.
Okay. So did you take the check for, I mean, maybe ultrasound or PET scan to make sure the endometrial come back?
No, I haven't had any kind of scans or anything. Unfortunately, it doesn't really show up on ultrasounds.
Mhm.
So, and it's also a little invasive to have a pelvic ultrasound. So I try to
Oh,
avoid
yeah.
it if
Mhm.
possible.
Okay. So actually, after the COVID infection, even the pain become worse, but you still just take the medicine, take the pill to maintain it, right?
Yep. One of
Okay.
the unfortunate side effects of the pandemic is it was very difficult to access proper medical care.
Yeah.
The clinic that all of my doctors were at, they did everything in their power to limit appointments, especially in-person appointments. So as a medically complex patient, I haven't really had any kind of medical care since the pandemic
Okay.
begun, unless, I mean, I've been in the ER a few times, but other than that, I haven't seen my primary physician for years.
Okay. But even now, I think the pandemic, I mean, the surge has done. So it's still difficult to make an appointment with your doctors.
It is. I also just moved here about 6 months ago.
Oh, okay.
And so I am just now getting my health insurance settled, and I have an appointment to meet my new primary in the first week of December.
Okay, got it. So between two periods, do you also have some symptom belong to the endometriosis, just like abdominal pain or abnormal breathing?
I pretty much always have pelvic pain.
Yeah.
It is, much more painful during my cycle. But yeah, I have constant pelvic pain. I have a lot of pain with sex. And when it gets really bad, we call it endo belly, and the bloating is just unreal.
Okay. Yeah. Okay. I think these symptoms you just talked. They are very typical symptom about the endometriosis.
Yes.
Okay. So how about your pee urination? Is okay?
So because of the POTS diagnosis, I'm supposed to drink as close to 1 gallon of fluids a day.
Oh, that's too much, I think.
You're telling me.
Yeah.
All I do is pee. That's just my life, is napping and going to the bathroom. So I do that to keep my blood pressure up. I have a tendency to have very low blood pressure.
Yeah.
I'm also on a very high sodium diet, also to increase the blood volume. So yeah, I eat salt, I drink water, and I nap.
But I got your simple information from website. Your current meditations include the metoprolol, right? Metoprolol, but the metoprolol is a beta blocker, right?
It is, yeah, it's a beta blocker.
So it can decrease the blood pressure, right?
It does decrease my blood pressure a little bit. Thankfully, not too much. But that is the medication that controls my tachycardia. Without it, my resting heart rate is in the 120s. And when I stand, anytime I'm in an upright position, my heart rate just steadily goes up and doesn't stop increasing unless I lie down. So
Yeah.
the metoprolol is what allows me to be somewhat functional. Before I started that, I couldn't stand for more than a couple minutes at a time.
Yeah. Actually, now we faced conflict condition. You drink a lot of water, but
Mhm.
you also take the metoprolol to, I know because you like to maintain your cardio, your heartbeat speed, like maintain it stable, right?
Right.
But actually, it's very interesting. First one, if you always feel tired, most of the time, that means your heartbeat, your heart power is lower. So that makes the blood circulation delay, slow down, and make your metabolism slow down as well. But at this condition, you also take the medicine. I know because for the stable your heartbeat, but the beta blocker will decrease the heartbeat. So it makes the heartbeat speed lower and lower. Then you drink a lot of water. The water will delay your blood flow because you drink a lot of water in your belly for just a short period of time. This is one of the etiology in our theory. The damp or the water retention problem. So all these conditions come together can make you always feel, first one, low back pain. Second one, your body heavy and maybe swelling, and tight. Okay, can you hear me?
Are you there?
Yeah. Can you hear
Okay,
me?
sorry, you froze on our end.
Okay, so where should I talk again? The last
The part
sentence
when-
you hear me. Which sentence you hear at the last one?
The what part when you were talking about drinking too much water,
Yeah, the
okay,
too much
good.
water.
what it does.
Oh, okay. So again, if you drink a lot of water, too much water, the water retention will happen in your belly. That is a resistance for your heartbeat. Okay, can you hear me?
Yes.
Oh, okay.
Yes.
Oh, okay, good. So that's why I say that this is the opposite. There are many factors happen together, but they are opposite. So actually, you need make your habit stable, but the foundation of the habit stable must establish on the enough power of your habit. So now, if we like to change this condition, first one, you need to decrease the quantity of the water you take now. It's too much, okay? Again, if you feel thirsty, you need to drink water. But if you do not feel, actually your body do not need water, you don't feed it too much. And the second, you can monitor your blood pressure every day, but you can consider about the dosage of the metoprolol. If you like to make adjustment or not, you can discuss with your doctor. I just give you a suggestion. If you like to stable your heartbeat, your blood pressure, the foundation, the background is your heartbeat is enough to maintain your body need. Yeah. And one more thing about your diet. Did you like eat low temperature food or like ice cream or any low temperature thing?
So part of the POTS diagnosis, as you can probably see, I have a lot of sweating in my face.
Yep.
And since the POTS has gotten really bad, I am constantly overheated, and my body, as part of the autonomic dysfunction, has a hard time regulating temperature. So I basically can't feel cold anymore. I'm always too hot.
Okay.
So I do enjoy drinking cold fluids. Occasionally, you know, when it's in the 90s, I'll have a popsicle.
Yeah.
But I'm not a big ice cream fan.
Okay. But actually,
But I also love tea, and I drink a ton of hot tea every day.
Okay. So actually, you like cold water, right? Because you feel hot.
Yes, because I'm constantly
But
overheating.
But at the same time, you also like hot tea.
I do.
Okay. So but at the same time, when you feel hot, do you also drink hot tea when you feel hot?
Not really.
Okay.
I usually have hot tea as breakfast. And after that, it's iced, or at least room temperature. It's hard to drink hot fluids when I'm drenched in sweat and feel overheated.
Yeah. Okay. About the hot, I mean the heat you can feel. Actually, in the clinical practice, many patients tell us about this. I mean the body temperature feeling. Okay. But you should know a concept. If a person feel hot, the hot feeling sometimes is not really higher temperature in people's body. It's just like a compensation phenomenon. Okay, so if people got the cardiopulmonary function lower, sometimes, especially when people feel tired or low energy level, people can also feel hot feeling.
Interesting.
Yeah. So maybe you can practice an experiment by yourself. I mean, first one, decrease the water intake, no matter ice water or hot tea. Decrease the water retention possibility, and let your heartbeat can do the thing it need to do. I mean, decrease the loading of the heart. Yeah, and you need to try to start to take some exercise. Of course, you can start from a gentle stretch or low speed walking, but you need to take exercise to help your cardiopulmonary function become better. So you can think about this. If you can decrease the water retention, I mean, the peripheral resistance can be decreased. And you take exercise at the same time, you can increase your cardiopulmonary function. So that also means your heartbeat and your blood flow phenomenon can become better than before. So the temperature compensation phenomenon can be decreased. Okay, so you can try to do this maybe 1 week and see what happens. If the temperature you can feel become, back to normal, more normal than before. Maybe you can feel, the frequency of the heating feeling decrease, or the temperature seems slowed down, not so hot than before. Then you can make sure, okay, the thing I did is right.
Right.
Yeah. So I can give you this suggestion. This part you can do by yourself. Just do some regulation, do some adjustment for your habit. Okay. So and one more thing. Okay. There's a doctor say decrease the sodium Yeah, I think that's another good idea because the higher concentration of the sodium will keep the water stay in your body. Okay, so if you like to adjust the quantity of the liquid you take, you can also adjust the sodium intake as well. Yeah. And one more thing, if you can decrease the water retention problem, I believe the menstruation pain, the period pain can also decrease because it's all all the things is about the circulation, right? So if you can make your circulation right and become better, the blood circulation issue or the blood stasis issue will be better. Okay, so before I ask the host take your pulse and check your belly, I'd like to ask you the last one question about your diet. How about your appetite?
I don't really have one. And I know that sounds funny, as I'm obviously in need of losing weight, but I often just consume liquids, or I eat a lot of plain rice. I have constant nausea, especially it's horrible in the mornings. So yeah, rice, veggies. I love broccoli. And
are you a vegetarian?
No, I used to be. But one of the issues with the pots is my circulation is horrible. And so I've lost about 50% of my hair. And my nutrition labs, so like my albumin levels are horrible. And so my doctor said, you haven't had meat or eggs or cheese in 20 something years. Your hair's falling out. At one point, my toenails were falling off. And he was like, this is telling me that your nutrition is not good.
Imbalanced. Imbalanced.
And so I started eating meat for the first time since I was 13.
Yeah, good.
And I do feel a little bit better energy-wise with that, but my hair hasn't grown back. I gained a bunch of weight, of course, going from vegan to omnivore. But I do crave meat now, which is very strange after many, many years of being vegetarian.
Okay. Yeah. So I think you have long-term nutrition imbalance problem. So I think your doctor give you a good suggestion, just like you said. You need to take balanced nutrition intake. And one more thing, again, in addition to you drink a lot of liquid every day, about your diet, your meals, you still most of the time you take the liquid meal, right?
Yeah, I will. If I'm super nauseated and I can't stomach the idea of food, I will make it's not really like a protein shake, but I'll be like soy milk or oat milk with this vanilla protein powder that I actually enjoy the taste of.
Actually, do you know a concept? More water retention in your stomach can make you easy vomiting and nausea. Yeah. So just like I say, it's a confliction. It's opposite thing. Yeah. Everything you try to do for your health now, but it's opposite. It can make the things happen again and again. I mean, the symptom happen again and again.
God, that feels like the story of my life.
Yeah. Okay. So there's another doctor ask me, do you reduce the rice intake? I don't think so. I think you really need intake the rice, because the rice is so balanced food. So yeah, so you can take a vegetable, you can take a meat, you can take egg, you can take fish with white rice.
It's
And,
funny because I actually crave white
Uh-huh.
rice now.
Yeah. And please decrease all of the liquid you take every day. But of course, if you like to, if you feel thirsty, please go ahead, drink some
of
warm
course.
water. Yeah, but if you do not, stop it.
Okay.
Okay. And okay, so this is your appetite, your GI, your meals, and I remember you seem to say you got some constipation problem.
No, actually,
Okay.
I have for basically my entire life had the other. I've always been very prone to diarrhea.
Oh, okay. So do you have poop every day?
Yes.
Okay. And then most of the time it's diarrhea, right?
Yes, I actually take a medication called loperamide, which is just, at least in the States, known as Imodium. So I take one pill, which is 2 milligrams, every day, because if I don't, I am in the bathroom 10 to 20 times a day. And that, well, I mean, that's obviously not really compatible with living a life.
You know what? This is another obviously evidence to prove it's really too much liquid stay in your intestine. So that's why your poop always not shaped. You know, for TCM diagnosis way, we always find many clues to, to identify different conditions. And we also think about, okay, all the symptoms seems not, there's no any connection with all of them.
Right.
But the TCM just can find the clue to connect it all the things. So again, please decrease the water intake every day. Yeah. Okay, so, it's really less than one question. Do you also feel dizziness sometimes?
Oh yeah, all the time.
Okay. Always,
especially if I stand up too quickly.
Yeah,
it gets very sparkly.
That's what I really needed to know. Yeah, I almost can find what kind of the prescription I can give you. Yeah, it's more easy, but you should know many things to, to do some adjustment for them, because for a long time you always give yourself the wrong the wrong way for your health. Yeah, so I think after I collect the information you told me, I think I can find some way, some direction to help you.
Fantastic.
Yeah, good. I like it. So, okay, so after our discuss, I'd like to ask the host and Tina to do the pulse taking and the belly checking for you, okay? Okay, thank you.
I'm going to check your pulse first.
Fantastic.
So he's going to zoom in with his camera.
Okay.
Okay, Dr. Lin, the hands are cold.
Okay.
Relax.
Initially, it feels deep and no pulse, but when you wait a little bit, you can feel a force it feels tight. It doesn't feel like a regular forceful. So many of the people who are slightly overweight have this kind of pulse. It's very deep and tight to me. The chun is deep. Strength is about normal. The guan is deep and forceful.
The chun is also deep and forceful.
Not as forceful as guan,
Okay. Less
and
than guan.
less than guan.
Okay.
And Chi, there's not much pulse, pretty much nothing.
Mm-hmm.
Yeah, it's very deep and tight overall. And
Okay.
then on this side,
Oh, we do both.
yes. This side, the hand feels cool too. Chun is on the mid level and slippery. Force is about normal. Guan I can feel on the superficial level and it's forceful, slippery. Chi is deep. This pulse feels kind of thin and slippery too. So there you can feel the pulse a lot more on this side. So again, the chun is mid-level, slippery. Guan is superficial, slippery, strong. And Chi is deep, slippery too. Okay, thank you. So
Can you turn the
we'll-
volume up in this when you have a second? Thank you.
All right.
I'm
Thanks,
going
Sam.
to take a picture of the tongue and then send it to you, Dr. Lin, so you can
Okay.
see better.
Yeah, sure.
Okay. Fine. Dr. Lin. Okay. So tongue to us looks, can you stick it out more?
Mhm.
Oh, to the
Oh,
camera.
sorry.
What does that look like to you, Donna? It doesn't look red. Okay, go ahead and put it back in. Rest a little bit.
Thank you.
Yeah, because you know the color changes when you stick it out for a while.
I did not know that.
Yeah. Yeah.
That's
Okay, one more time, please. So the coating is slightly yellow and teeth marks for sure.
It's looks greasy. The coating is greasy.
Okay.
And then there's slight purple. There's slight. So it looks like a thin yellow greasy coating. There's teeth marks. And it has a undertone of purple. Okay, look your tongue up under your tongue. Like this. Okay. There's some those distended veins are showing.
Did you get a picture?
No, this sorry.
Oh, okay, Dr. Lin, is that picture okay that I texted you?
Hold on. Let me check. Yeah, I think it's okay. Yeah,
Okay.
and how about the eyes color?
The eyes color? Okay.
Yeah.
Can you look into the
Mhm.
camera? Okay, we're gonna check under your eyes to see if you have anemia or not.
The
It's
color
very
seems
pale.
very light, right?
Yes, very light.
thank you.
Okay. Okay. One more question, Eric.
Mhm.
Can you hear me?
Yes.
Okay. Did you also always feel belly full? I mean, more guessing?
Gassy? Do you feel gassy and blurry?
No,
No.
not really.
Okay.
Only if I eat.
Mm-hmm.
I mean, this hasn't really happened in a long time, but
Mm-hmm.
if I eat too much,
Yeah. Mm-hmm.
I tend to be more of like a snacker than
Mhm.
having like a full meal.
Okay.
So I like to have maybe a handful of crackers, a cup of tea,
Yeah.
and then a couple hours later, same thing.
Mm-hmm. So, according to the color of your eyes, I'd like to ask you one more question. How about your sleep?
Sleep.
Yeah.
I don't know her.
What happened?
Since I was a very small child,
Uh-huh.
have had horrible sleep.
Okay.
Unless I take a handful of pills,
Mhm.
I just don't sleep.
Okay, so you cannot fall asleep, right?
Right.
Okay. So even you take the sleep helper medicine, you can fall asleep. How about the quality of your sleep?
Horrible.
Still horrible?
Yeah, because of my Ehlers-Danlos joint pain and
Mhm.
muscle pain, it's really hard to find a position that feels comfortable.
Yeah.
So I am just constantly flip-flopping and moving and trying to, I've got pillows everywhere.
Yeah.
And yeah, sleep has always eluded me.
Okay, got it. So have you had any experience, even you don't feel joint pain or muscle pain, but still cannot fall asleep?
No, it's pretty much always pain
Okay.
centered.
Mm-hmm. Got it. Okay. Okay, I have no question anymore. So please take a belly check-in. Thank you.
Thanks.
Okay.
Yeah.
Can you lay down?
Of course.
We're gonna check your belly.
I apologize. I am very sweaty.
Oh, no worries.
Oh, thanks.
Okay, can you see this angle okay, everybody? Dr. Lin, is this angle okay?
Yeah. Can you put the camera higher, because I just can see
Yeah.
half of the belly.
Okay, that's what Sam is doing now.
Okay.
How about now?
And move. Okay, I think it's okay now.
Erica looks like our first English patient, and also the Chinese patient who has a lot of water. If you were in that class, you can see the belly just looks like there's a lot of water retention. And veins. So first we're going to check the temperature. So I'm gonna use my hand.
Oh, my hand is kind of cold. Is your hand cold?
Oh, it's fine. Don't worry about me.
Okay.
Oh, her belly is actually colder than my hand.
Yeah.
So here's cold. So cold right here, coldest. That gets a little warm. Around the belly button is cold. Actually, surprisingly, here is warm.
Okay.
I am on my period right now.
Oh, okay.
What day is the period? First day?
Today is day 2.
First day 2. Okay.
Yeah, this area is very cold here. So right along the ribs here, all warm here. Yeah, it's coldest here. It's cool on the two sides. 少腹, warm here. Warm here. Yeah, so pretty much it's cold here and cool on the two lateral sides. And it's all warm here and warm here.
Okay.
Do you notice that yourself?
Yes.
Okay. That's the temperature. And looking at the texture, it looks smooth to me. I don't see any rough spots, but I do see the veins. And then from here on, let's do some tapping. Thanks. I don't think you guys can hear it. There's not a lot of hollow sound. There's not a lot of gas. It feels pretty much the same in all areas, Dr. Lin. It just feels like there's like a lot of water
Because
underneath.
yeah, because the liquid, the water spread all of her belly. So
Right, everywhere, right?
yeah.
Okay. Let me know if you have any pain, okay?
Thank you.
Yeah, it's very cold here. How about pain on this side?
Yeah. Just
Okay,
when you-
pain here.
That deepest.
It's not very deep. I'm pressing, by the way.
Oh,
But it's
feels
pain.
like it.
How about this side? Is it okay?
It's a little
Little tender?
tender.
Okay, so pain along the ribs down here. To the right side.
Oh,
So both sides. Too painful here. So painful on both under the ribs. Okay.
Erica, do you feel stressful or anxiety recently?
oh yeah. I mean, 24 hours a day.
Okay. Okay.
Any pain over here? Nothing.
No.
Okay, let's check on this side.
Right. Yeah.
Right here. Pain here. How about down here?
Yep.
This is the spot Dr. Lin always likes to check between the belly. This is for blood stasis in the lower
Yeah.
jaw. So, Dr. Lin,
Yes.
the anxiety and stress question you asked, is it if both sides are painful or just the right side is painful?
It depends on patient because in clinical practice, some people got stressful or anxiety or I mean just mental pressure. Sometimes you can see a bilateral side under the cage. People can feel hurt if you press, but sometimes just only happen on one side. So it depends on patient.
Okay, does it also mean if bilateral is more severe?
Actually, I don't think so because
Okay.
you need to check by 望闻问切, you need to put all the information together. So
Together.
you cannot just take one or two maybe standard for the SOP because there is no really SOP in clinical practice.
Right, that's true. Okay. Okay, anything else you would like to see from the belly?
How about the right side 少腹? I mean the opposite side of the left side pen, the left side, the pointer pen, you push the opposite side of the right side.
Any pain here?
No.
So good.
Okay. How about the lower part of the umbilical? 肚脐底下. Yeah.
She didn't have pain.
No. It's about nearby the 关元穴.
Anything?
No.
No.
How about push deep? Maybe push deeper.
Is it okay to push deeper?
Of course.
Erica?
Whatever you need
Okay.
to do.
No pain?
No.
Okay, so please back to the left side, the pen point on the 少腹. If Tina push deeper, is the pain become worse?
Yes.
Okay, good. Did you have a poop this morning, Erica?
No.
No. How about yesterday?
Yes. Twice yesterday.
Okay. How many times you poop every day regularly?
Once or twice.
Okay, good.
Is it watery, by the way?
And
If I don't take the
Imodium.
Imodium, yes.
So you are taking the
Like
Imodium,
literally like liquid.
water,
Yeah.
mhm. Okay. Tina, can you also check Erica's 太溪脉, the ankle pulse?
Okay.
Let's come
Yeah.
down here, please.
Yeah, you can
Oh, I
cover
don't know how
her.
to
You
check
can
this one.
you can cover her belly. I mean, don't Yeah.
Don't expose. the
yeah, don't
belly.
expose. Yes.
Okay, can you review for me real quick how to take the Tai Chi pulse?
Yeah, you just put your fingers between Achilles tendon and medial
Malleolus?
malleolus. Yeah, just nearby 太溪穴.
Oh, I don't feel anything.
Okay, good. Makes sense.
Make sense?
That makes sense. And how about the left side? Most of the time, 太溪穴is located in the deeper part. So maybe you check it more gently, slowly, and
Okay.
precisely. Yeah.
Gently first. I remember in one class you said this is to diagnose the kidney, right?
Yeah, kidney or 元气.
元气 to see if it's weak or not.
Uh,
You guys
yeah.
at home can take your own pulse. I don't feel either side.
Okay, good.
Okay.
So, okay, actually, I have no more questions. So just see if anybody have any question.
Okay. I think we're all set for the evaluation part. So we
Okay.
will take a break for 15 minutes and come back.
Okay, sure. And one more thing, Erica.
Yes.
I will give you the prescription in the second part. I will tell Tina, and also I will tell her and let her tell you about the not only prescription but also the health education. And,
Perfect.
Yeah, I mean, you need to do some adjustment for many things. So I will tell her and let you know.
Thank you.
Okay,
Okay,
thank
you're
you
welcome.
very much, Erica. So let's take a break for 15 minutes, come back at 10:30. This is when Dr. Lin is going to think about a formula and the acupuncture point treatment for Erica. And as a good exercise, you guys can do the same. Please write a formula too, and then we'll compare and ask questions. All right? Let's take a break. Thank you.
Recording stopped.